All right, so Laura Pilcher is joining us today. Laura is a former student of mine, so you can pick her brain about that too if you want. But Laura is in private practice in North Carolina, and she also works at the LGBTQ Center in Raleigh. And so she works with the youth at the LGBT Center. And in her private practice, she sees a wide variety of individuals, but really kind of specializes in working with individuals in the community in the sense of the LGBT community and providing support for them as they transition, as they navigate relationships and just life stressors in general. So I really appreciate you being here, Laura. I know that your time is valuable, and so making time for this is really appreciated. So I'll give you a chance to tell a little bit more about yourself and just tell us a little bit about your background.
Okay. So Dr. LA kind of give you a very brief introduction about what I do. I guess I'll kind of start at the beginning, like where I how I started getting involved with the LGBTQ community. So in grad school, one of the first classes we had was our diversity class, and our project was, what population would you want to work with, and how would you build cultural competency around working with that population. And right off the bat, I knew I wanted to work within the LGBT community because prior to starting grad school, I worked in an inpatient hospital setting. I worked with children. I floated between 5 different units. So we had a child unit all the way through geriatric unit. And so when I was working in the adolescent unit, one of the things I really saw was that youth's gender identity and sexual identity was treated more of as a symptom, especially for female identifying patients. Their sexuality was treated more as attention seeking, and that really didn't sit well with me. And so I knew that as a professional, I kind of wanted to be that change and wanted to be that safe professional that, whether my patients or clients could come to and that would really advocate for them. And so in my undergrad, I took ASL and worked and kind of immersed and part of that in my undergrad program at Northern Illinois University was a requirement was immersion. And so I knew that to really understand a culture, you had to immerse yourself within that culture. And so that's kind of what I wrote about in my project. And so right after I did that, I was like, okay, well, then what am I actively doing to immerse myself within the queer community? And so I sought out a volunteer experience, and the closest one to me that I could actively immerse myself and be in person and was actively doing something was at the Raleigh Center. And so I signed up to be a volunteer. It was an 1.5-hour drive for me, and I did it every Sunday. And so I volunteered as a regular volunteer, operation front desk, answering phone calls, welcoming visitors. And then from there, I really wanted to work with the youth, but I had to put in at least a year before they would even consider it. They were very protective over their youth at that time. And so I did the work. I volunteered every Sunday for a year, and then I started working as a volunteer with the youth and kind of got their youth drop-in, which was a weekly drop-in for youth to kind of just come and hang at the time. I got that back up and running. I did that for a little over a year. And then the youth and family programs coordinator at that time decided he was going to step down. He had been doing it for a very long time and wanted to prioritize his family. He was going to get married to his partner for a very long time and just really needed to prioritize him and his partner. And so then I was offered the position. And so I've been doing that for, I want to say, quite a few years now, almost 3. Time kind of flies, and the pandemic has kind of like lost my sense of time, but I've been working as the youth and family coordinator for a while now. So I oversee all the youth and family programs at the LGBT Center of Raleigh. And even during the pandemic, we've kind of grown and expanded our youth offerings. So during my time there, we've expanded. What used to be our programs just served youth ages 12 to 18. Now we serve youth 8 all the way up to young adults to age 24. So I've expanded that offering and the programs that we offer. We've added several programs. And during the pandemic, we moved into a virtual space. And now as the pandemic is easing, now we're kind of moving into more of a hybrid model and offering both virtual and in-person spaces. And I've also, during my time there, worked on training and working on more of a straightforward and way to recruit volunteers and things like that. So I'm really working on like, how do we put safeguards in place, like trainings and background checks and things like that, where before there wasn't really a clear way of bringing volunteers on board, other than you just had to volunteer with the center for a year. So there wasn't really a good way of doing that and retaining really steady adult volunteers for them. And then also during the pandemic, I kind of had a career switch. So I switched jobs right as the pandemic started. And then a week later, I lost that job. And so it really allowed me to refocus on my passion. And so I really knew that finding affirming therapists for the youth I worked with was very difficult, and for the population I served at the center. And so I specifically started a telehealth practice. And so I get asked all the time, are you going to go into in-person? And my answer is no. Like, I specifically started a telehealth practice, not because of the pandemic, but to reach those in rural areas that have trouble accessing care. And so I serve youth age 12 and up, and young adults within the LGBT community. My caseload specifically is right now heavily youth who are navigating gender identity issues, maybe dealing with gender dysphoria. I have clients who are navigating relationship issues as far as like dealing with opening the relationships up, considering non-monogamy or polyamory. I have clients navigating different aspects of the LGBTQ identity and things like that. But my oldest client is early 30s. So most of my clients really fall in that young adult range. Or my youngest client is 12 and just turned 12. So kind of where I am. And I do also do trainings and stuff through the center. Like, I've spoke to Wake County PTA and things like that.
You also have consulted with other agencies like the—
Oh yeah, I kind of love that up. Thanks, Dr. Lake. So also here in my area is Sandhills Pride, which is why I had to go to Raleigh. So when Sandhills Pride originally is an LGBTQ organization, but they've never offered programming till very recently. So I've been working very closely with their new executive director, Michael, who he's really been trying to push programming. And in his very short year and a half that he's been with Sandhills Pride, has started a program. He offers a parent discussion group. They now have a trans non-binary discussion group, and they just now started offering a women's and men's group. And so I've been really working with him on how to start programming, how to support his programming, how to get funding for his programming, how to also set safeguards in place with that. So yeah, I've been doing a lot of consulting with him as well, and how to support him and the agency here locally on my level, which is kind of nice because I get to attend events and things like that. So it's kind of nice to do things here, and I don't have to drive an hour and a half to do it.
But I wonder, Laura, if we took back in time, right, and we went back to say when you're graduating, if I had said this is where you would be at this point and the types of things you would be doing,
I probably would have laughed at you. Yeah, so it's kind of surreal. It's still a surreal every day. I kind of have that imposter syndrome sometimes when that I experience. So I get asked to do interviews a lot through the media. I get asked to do trainings. So sometimes I have to take a step back and I'm like, am I really qualified to do this? And I remind myself, yes, I am. And I continually am doing trainings and learning and trying to get certified through WayPath and things like that. So I'm always pursuing and learning more. But yeah, if you would ask me like 3 years ago when I graduated from the Chicago school if I would be doing this, my answer probably would have been, no, you're kidding. I just want to volunteer and do the front desk and help the youth. Like, no, I want to be the background person. But Yeah.
So if you can talk a little bit about the training with WayPath that you're planning on doing, because that's a great, it's expensive, but it's a great certification to pursue afterwards if you're going to work with sexually marginalized populations, especially transgender. Yeah.
Yeah. So WayPath is, let me see if I can remember the acronym. So it's the World Association for Transgender Health. World
Professional Association for
Transgender Health.
Mhm.
Yeah. And so they kind of have set the standard for working with transgender and non-binary and gender non-conforming individuals, both within mental health and the medical profession. So they kind of set the worldwide standard for that. And so most mental health and medical professionals follow their standards. So anything from writing a letter of recommendation and referral to gender affirming care, to what does gender affirming care look like, from using hormone therapy and or surgery, anything like that. They've kind of set the standards for that. And so as a mental health professional going through their training, so I can better understand what those standards are, so I can better support my clients, is really important. I've done a lot of the research, but to have a really good in-depth understanding of that and to say that I'm certified, and so that my clients come to me with a confidence that I can kind of handhold them through that process and recommend other professionals that are also certified or that really know what they're doing, so that they have the confidence that they're going to get the best care possible. And also really understanding that there's a difference between like navigating that sometimes, like going to places like here we have the gender clinics such as Duke and UNC, but they have long wait lists and sometimes require lots of hoops, such as recommendations and stuff like that. Well, my adults necessarily don't have to go through as many hoops because there's the informed consent model. So as long a lot of professionals who are trained in the informed consent model basically means if they understand the risks and benefits, a professional can provide them care. So it takes out some of those hoops in that wait list. And so being able to inform my clients on that and what professionals offer that model of care. So being able to tell them, here are all the options, and making sure they really understand. And so taking out some of the barriers my clients face, being able to access gender affirming care is really important.
Mm-hmm. So I'll start with one other question and then I'll turn it over to these wonderful people for their questions. And so my first question is, I know that you have worked with some couples, one couple of mine is coming to mind immediately, but who are navigating kind of what it might mean to be in consensual non-monogamy. And I'm just wondering, what's your role in that as a therapist, and what types of supports would you provide, somebody who's going through that?
Yeah, so my role as a therapist is to support my client. So because I'm an individual therapist and not a couples therapist, I don't do couples therapy, I support my client in their navigation through that and making sure that engaging in open consensual non-monogamy is really what they want to do, and that they're not doing it because their partner wants to do it. Help them navigate it to make sure that's really what they want to do. So I provide access to resources such as psychoeducation, support groups, things like that, making sure they're really getting a non-biased look at it so they can really consider, is this an option that they really want for them personally? And not just something that they're doing to try to keep or stay in a relationship. So really making sure they understand it, even if they're getting feedback. So the couple I know Dr. LA is thinking about sometimes gets feedback from their couples therapist or from friends and family that sometimes supports a bias. And so making sure that my client is really getting a well-rounded perspective so that they can make the best decision for themselves and for them and their partner. So that's my role as a therapist, is to completely be non-biased and make sure my client's getting the support that they need and keep my opinion out of it.
But and you never have any type of reactions to what your clients say or do, right?
I may have them internally, but I try to do a very good job of not showing them externally. I think one of the things I left out is, I used to work in clinical mental health at South Lake Healthcare in Raleigh. So I worked with clients with borderline personality disorder, who are highly suicidal and things like that. And so I'm very good. My clients used to say things with lots of shock value. So I'm very good at like not reacting to those shocking statements. And so I've had a lot of practice at that. So I'm like, oh, that's interesting. Tell me more about
Yeah, that's a
that.
good one, isn't it? Oh, that's interesting. Yeah, tell me more. Right. Okay. Does anybody else have a question they want to ask Laura?
I have a question kind of going alongside what just being brought up. I guess as student and or just entry-level clinicians, we're still learning how to absorb that shock without react. I guess my question is, do you have any tips on how to build that kind of resilience, or just like at a beginning stage, and especially as we're absorbing new information, and some of those information might be completely new and we never heard about it.
Yeah, so I think the skill that's really helped me, I actually took from DBT. So practicing mindfulness. So I really have to sit with my own reaction and my own feeling about what it was that was just said before I react. So learning mindfulness helped me kind of control my own emotion and reaction, and being very aware to what am I feeling in my body? What is my face doing, so that I can control and regulate what's going on before I react to my client or react to what my client said. So I don't automatically have a response. I sit with it, and I sit with my own feeling and emotion for a couple minutes or a couple seconds before I give a response to my client. And sometimes I just sit in silence. Silence is your best friend. I know a lot of times, and that's something you have to learn to get very comfortable with as a clinician, because silence can be uncomfortable for individuals. And a lot of times my clients get real squirmy because I'll sit in silence with them. And I'll be honest, I've sat in silence for a good 10 minutes before my client will say anything. But I'm like, this is the space where I just let them think and process, because sometimes your clients need a moment to really process what's going on. And it takes a lot of practice as a clinician to be comfortable in that silence and giving those clients the space to talk. And so that's kind of like an internal thing, being able to use mindfulness and practice, like get comfortable with your own uncomfortableness. And so you don't always have to fill the space with something. The goal is let your client talk more than you.
They should always work harder than you.
Yeah.
All right. Thanks, Lizzie. David or Kaylee, you got any questions?
I've got one. I'm curious how you go about sort of knowing truly, because I know you said that you had to immerse yourself in that population so you could really understand the culture and the struggles and that sort of thing. And I'm curious how you kind of, I don't want to say trust yourself, to know that you're really understanding. I think part of my concern is that I would think that and I know that you can't know everything. I acknowledge that I will never know everybody's experience, and I can't even act like, oh, I have a general grip on what these things are, because everybody's, experience is so unique, and their life experience is so unique, and the intersectionality of all these identities. But I wonder at what point you feel comfortable, kind of saying that this is a population maybe that you specialize in, or how do you know that you've moved beyond ally and really truly can support somebody in these things? I know it's kind of rambly, sorry.
Yeah, I think that's actually something I'm learning, that I'm learning more and more each day. Especially because I'm moving beyond just the ally thing. I'm starting to like have feelings and emotions. So when things happen, like I'm starting to have a reaction, and to those things. So I'm starting to get more upset about things. And so like where before it's like, oh, that's just not right, or you shouldn't do that, where it's more like I'm starting to like kind of feel like, I don't know if this is a good way to put it, like mama bearish about things. I think maybe that's a good way to describe it, with when either my clients are being hurt or my friends in the community are being hurt by something, I have a gut reaction to it, and so Dr. LA always calls it moving beyond allyship to accomplice. And so, but I think the biggest thing for me is I really work hard to not be always the voice, but let those in the community be the voice. They know themselves the best, including my clients. And I even remind my clients of that. Like, you know best. There's no right way to be LGBTQ or to be queer, right? There's, even with the community, because I think also understanding even within a community or within a marginalized group, there's always bias within bias. And so, and sometimes the marginalized people can have the most bias against each other and microaggressions. And so being able to understand that, so microaggressions can be used, and that was one thing I learned and experienced within working within the LGBTQ community, was that there was a lot of microaggressions against each other and biases against each other. And so a lot of populations within the population were discluded. And so that's something I really work hard on, especially within the youth community, is, you know, how do we bring some of those marginalized groups more to the forefront? So for example, like those with disabilities or people of color in the Black community, like how do we really bring those voices more to the forefront and making sure we're showing equity in those spaces, especially when for so long, queer spaces have been predominantly cis and white, especially predominantly male, cis and white, and guided. So really working hard. And thankfully, the director at the Raleigh Center, our new director, is really working hard to kind of change the direction and the movement of the space that we're kind of in. And that kind of happened by like swapping up our board members. Like our board members used to be all male and white. And so now we have only one person left. So now it's more diverse. Our board's more diverse. So it's really doing the hard work. And even with doing that hard work, you being prepared to deal with pushback. So when we did that, we got a lot of pushback. I was even personally attacked a couple times. And so being willing to like deal with that sometimes can be rough. But I think it's all about letting other voices be heard other than your own, and listening to those voices, even when it's hard. It kind of goes back into being able to sit in the uncomfortableness.
Yeah, thank you for that. I think one of my questions dovetails into what you were talking about just right there. And because I was sitting here thinking about this, especially in Pride Month, and you were talking about your activities there. And I think, you know, the presentation, of course, is LGBTQIA, whatever, you know, and it's all on one sign, you know, as if this is one uniform, you know, group, and without its distinctiveness and without its uniqueness. And so I'm curious, especially with transgender, other than the obvious, what are the unique dynamics they bring to the table in therapy as compared to possibly gay or lesbian or asexual or something, and I think in my own experience, I have more experience with gay and lesbian friends and clients than I do with transgender. And so what are the unique aspects that they bring in terms of their story to the table that you hear a lot?
Oh, wow. I could go on all day about that, but so there's so many unique aspects to working with transgender and non-binary individuals. I think just with some of the clients I serve currently, I think the first thing that comes to mind is transition, right? There's no wrong or right way to transition or to present. And so I think a lot society automatically thinks they're going to fully transition to one side of the binary or the other, right? But that's not always right for everybody for various reasons, right? And I think society always has this one way of like, you need to present this way or you need to present that way. So not every client is going to want to go on hormone therapy or is going to want to have surgery or, you know, is going to want to dress a certain way or do their hair a certain way or whatever. And so that every client is going to navigate that in their own way and process that in their own way and do it in their own timing. And that includes everything from youth to adulthood. So we have some youth that, I work with and they think they're going to do it overnight. And so I have to manage expectations. Like, this is a process, you're not going to automatically present in your ideal vision overnight, right? So this is going to take years, especially, because there's time constraints. Like hormone therapy, a lot of times they're not allowed to even start until they're 15, 16 years old, right? They can go on puberty blockers, but they're not allowed, with medical constraints and rules, they can't start some of that stuff till they're older. And then surgery is another question. So sometimes I have to manage expectations. And then I have other youth that I work with that, they're, because whether it's fear or anxiety or they're unable to name it, are slowly moving on that process and that journey. They very much know what their gender identity is, but that transition process is taking a longer time. And so they're just slowly doing things, even with the most affirming families, because what are they getting from our outside world and culture right now? So even the transition process is going to look different for everybody. And then I've had clients that like totally choose not to, they may start hormone therapy, but choose not to do anything else. Or they may choose not to do hormone therapy. They may just choose to they may just choose to outwardly do their hair and clothes and socially transition. So everything, it just kind of depends on the client. And then I think another thing that really comes up is when it comes to like, I know you're in a relationship class. So when it comes to like relationships, navigating consent in relationships, especially sexual consent, and feeling pressured to do things that cause gender dysphoria, because it's either feel like it's like socially expected or that their partner expects it, I think is one of the things I really work with on clients. I have one client who has a lot of trauma and PTSD surrounded being raped or coerced into sexual activities that she didn't want to do and caused a lot of gender dysphoria. And so we're really working through that trauma that she's experienced because of that. And so that comes up a lot with transgender individuals. So there's a lot of sexual trauma that they've experienced from society, whether that's assault, things like that is another theme that more so now you may not experience with gay or lesbian clients, because society is a little more accepting, but they're not as accepting still of transgender and non-binary individuals. So there's still a lot of that I work through with individuals.
And I would say education piece, right, too, Laura, in the sense of educating that they have the right to say no, that they don't have to engage in these things. And even what are other ways that you can express your sexuality and experience sexuality that aren't triggering and traumatizing as well.
Yeah, that's definitely something, and advocating for my client. And yeah, like Dr. Lay said, the advocating piece. I had one client, I literally said to her, she really had trouble with like penetration, right? And so that caused a lot of gender dysphoria for her. She did not want to act in penetration. And I kind of just brought to her attention, like, I'm like, if you were your authentic self and everything was the way you saw yourself, penetration wouldn't even be on the table. So why is it on the table now? And it was like a light bulb went off for her. She never considered that. And so it was kind of like, whoa, you're right. Why am I consenting to this? Like, if I was my authentic self, this wouldn't even be a thing. Like, why am I like consenting to this? And so sometimes it's like bringing that mirror up to the clients and letting them see, okay, why are you doing this? Like, because a lot of times they don't have the capacity or ability to be able to have those hard conversations. And also giving them the space to like talk about that kind of stuff too. A lot of my clients feel like they're not even allowed to talk about sex. Like, I can't tell you how many of my clients will start to talk about it and then backtrack and apologize, like, oh, can I talk about this? I'm like, it's therapy. Yeah, you can talk about whatever it is that is causing you distress or problems or that you're trying to navigate. So that's definitely an issue that's unique.
Can I tack on a question to that?
You sure can.
So I'm curious, do you often just kind of broach it and say, we can talk about anything, including sex? What is your way of kind of opening that door to clients to show them that you're comfortable with it and welcome it if they want to discuss that?
Yeah, so I kind of let the client, kind of build rapport with the client, and I always remind them that they can talk about whatever they want, anything from the mundane, right, to sex, right? So I kind of remind my clients, this is your session, this is your time, right? But I also do encourage them not to avoid topics that they're avoiding. I will draw attention back to that. But I do kind of offer them the safe space to talk about whatever it is that they want to talk about. I kind of do it in the moment. Like I think your question is, do you do it like, no, I don't do it at the beginning of every like session or introduction. You can talk about whatever you want and sex. I kind of like gauge it in the moment. Like if a client's hesitant, because some of them aren't hesitant, they'll just jump right in. But if I see hesitancy, then I utilize that moment in the moment to advocate for that for them, to let them know it's a comfortable space. They can talk about whatever they want.
Laura, can you talk about the things that you do in your telehealth practice, like forms and other ways, your website, things like that, that you do to help convey that you are inclusive and,
Yeah, sure. So I think the biggest thing in that I'm inclusive, like when it comes to like right off the bat. So like on my website, I use gender neutral language. I use my own pronouns and things like that. And when I start off, so I offer a 20-minute free consultation with all the clients. I start off every consultation introducing myself and using my own pronouns and asking my clients what their pronouns are, like verbally, even though they filled out a form. So on their form, it asks for their name, their gender identity, what pronouns they use, things like that. I also have a very intensive form that my youth fill out, and I actually had to go back and change it because I like kind of panicked and was like, oh wait, this isn't very inclusive. It asks like, how's your relationship with your mother? How's your relationship with your father? And it was very binary to like traditional family. And after I had the first client fill it out, I was like, ew, this is ugly. And so I went back and I changed it. And so I changed it to ask them to just describe the relationships with anybody within their family unit or anybody they consider a support system or parental figure. And so then I included examples like your maternal figure, your paternal figure, or no, I didn't even say that. I said parental, anybody you consider a parental guardianship figure. And then I said, whether that's a parental partner or a step parent, grandparent, things like that. And so, or someone living in your household. And I included like examples like that. Adopted parent. I think I also included, I just lost the word. Anyway, lost what I was going to say. But yeah, and so I made it more inclusive because I also work with families. Even my kids have kids who live within polyamorous families. So they have more than one parental unit living in their home. So their parent may also have, I have one client who has a mother, father, and their mother and father have a partner living in the home as well. So they have 3 parental units in the home. So making sure my forms are very inclusive and open up for non-traditional families. Like even I lived in a non-traditional family when I was growing up. My parents were divorced, so I had step parents. And so making sure that those relationships are included in my forms and they're able to discuss those.
I'll ask a question unless one of my colleagues has one, and then I will defer. I'm curious about kind of your view on self-disclosure and how that helps or hurts a relationship with your clients.
Oh, good question. I think that's a good question. So I only use self-disclosure in the instance that it's going to help or support my client. I always check myself. Why am I using this self-disclosure? Is it because I want to share something, or is it because it's supporting my client? So I'm still very minimal about it. So making sure it's nothing that would, give them too much information, but just enough to like, okay. Or if it helps like build rapport. So like, I have a client who comes from a very strong religious background. So I self-disclose too that I also grew up in a very strong religious background. And so what that communicated to my client was that I understood and what the client was going through, that I came from a place of like empathy and understanding, that I understood that cultural dynamic. Does that kind of make sense?
I'm not even sure how to ask this question in a way, but that's never stopped me before. So, here goes. So I'm curious, especially someone like yourself who works, this is the focus of your work, and you see a lot of clients, and you said your oldest is 30.
Yeah, in the early.
So, and I spent 12, 15 years of my career working with youth as well. So, I'm curious as to, especially maybe with transgender, do you have some people who come to you exploring that
Yep.
with themselves, but then decide that's not who I am, or maybe I'm not headed down that path? And my guess is that's rather a minority, because if they've gone to the trouble of finding you and getting to you, probably they're needing more than likely they're needing the permission to move forward.
Yeah. So
but how does that occur, and what has been your experience with that? And I'm just curious as to that.
So in my therapy practice, no, like I have not encountered that yet. In my work in the center, that's kind of a tricky question, because I wouldn't say, because gender's fluid. So I wouldn't say they come knowing something like is amiss, right? And they come seeking our services. And so they may say, oh, I think maybe I'm transgender. They're not sure. They get more clarity about it. And a lot of times so I've had youth that have started out using they, them pronouns, and then they identify as non-binary. And then after a couple years, then they switch to using maybe he, him, or she, her pronouns, right? And then identifying more as trans. And then I have youth that stay in that non-binary state, or I have youth that come and they feel like, oh, maybe I think I'm trans, and they start using a more like male or female identifying name and those pronouns, and then they kind of think, no, maybe it's more binary. Or I have youth that kind of like depends on the day, like, and so I think it's because gender's fluid, but I've never had a youth really go, no, it was the gender I was assigned at birth. Like it's never they go all the way back there. It's just kind of like a fluctuation. So that, like I said, that question's kind of tricky, because it's never a clear, like, because gender's fluid there. Like that's kind of the answer to that. Is like, I don't know if that's really super clear because there's no real yes or no answer to that question.
Right.
Yeah, and that even happens in adulthood. People think it's just specific to youth, and that's not true. Like even adults, like now, because gender is fluid, even adults like will float along that kind of spectrum, or I even have an adult friend that says they fall nowhere on that binary. Like they describe it to me as kind of like a bubble, like their gender floats within the bubble, and it's like, ask me my pronoun today, or they just, most of the time they just prefer to go by their name. Like, don't use a pronoun, just address me by my name, please. Yeah.
Cool. Thank you.
Any other questions for Laura?
These are good questions.
Yeah, they usually do ask good questions.
You have somebody new with us. Does Mark have any questions?
Yeah.
Hi there.
Hey,
Sorry,
Mark.
I wasn't here for the rest of the presentation, so I'm not sure I'm entitled to ask a question.
You are.
You can ask a question, Mark. Any question you want.
anything you're interested about.
So something that some people at the site where I've been doing my internship have talked about or dealt with kind of internally is best practices in terms of counseling and surgery and the kinds of requirements that either states or specifically plastic surgeons have in terms of making sure that that clients are in the right place for the thing that they're asking for. And there have been some people at my site who've been fine with having treated a client and writing a letter, and others who were like, because you're an LPC and not, let's say, a psychologist or something like, and you haven't done, there hasn't been testing involved, you should stay away from this. Like, what do you feel the role is of LPCs in terms of like people choosing to at times go that route, and legally speaking, what our responsibilities or kind of ethical, what can we attest to, what can we say? I mean, we may think or feel something. I mean, like, is there I realize this is not a clear question. It's just coming off the top of my head.
Oh, okay. So Dr. LA has kindly put in the chat, there is actually a national world organization that has set the standards for transgender health, WayPath.
Thank you.
They also provide a certification, which I'm seeking. It's very expensive, but it's worth
It's very expensive.
very expensive.
Very expensive.
But worth it. And so basically, like, as far as therapists, right? So LPCs, LCHWs, like, our ethical responsibility is to basically provide informed consent with the client. So what that means is informing the client like what it is they're seeking and the risks and benefits to that. And so WayPath does on that website, there's a very clear outline and even graphs that kind of like show you, okay, like for THC, so hormone therapy, or HRT, so hormone replacement therapy. So there's a very clear guideline. Okay, here are the expectations of typically what would happen like each month, what you can expect once you start hormone replacement therapy. Here are the risks, whether you're seeking, feminization or masculinity. These are the risks involved in that, and here are the benefits you can expect from that. So being able to inform our client on those risks and benefits to what they're seeking. The same goes for surgery and all those other things. Those are all WayPath lays all those out very clear. So our job as therapists is to make sure the client really understands those and they've really thought about that. And that's in line with, what it is that they want. And also, but my kind of perspective as a therapist is also to believe the client when they say that this is their gender identity, to believe them and to validate that and to affirm that, to kind of come from an affirming stance. And so to kind of help them navigate that, and then to provide them resources and psychoeducation surrounding that. Is kind of what I feel my ethical responsibility is surrounding all of that. So making sure my client can gain the access to affirming care they need, and that I'm providing them the psychoeducation around it, and that they fully understand what it is, and also educate them around other ways to, non-medical procedures around affirming their gender identity. And I also provide my clients with like resources to peer support groups and stuff. Here, let's talk with other individuals who have gone through this process, right? Let's get peer support around it. I'm just one person. You need to also have a support network. So I also make sure my client has a strong support network before considering going through transition, because that can be very taxing. And so making sure that they have a strong support network outside just me as a therapist, in their home and in their environment, that they have peers that can help support them as well as they go through that process. And then WayPath also has as far as we're writing letters, the things that need to be required in that writing letter. So the time that the client has been considering this, the time that they have put in doing like social transition, things like that, using gender affirming pronouns, name, things like that is all in that letter. How long they've been seeking therapy or counseling around it. This WayPath lays all that out for you. Does that kind of answer your question, Mark?
It absolutely does. And thank you for the resource. And I believe that was actually the particular, when I saw one of these letters, it referenced those it referenced those standards. Or at least that's what's coming to me now. I apologize. I have F-18 Hornets flying over my head all the time. Okay, somebody else has a question. So if I might just add one more question, which is, I've read an article that was trying to do a meta-analysis of the kind of longitudinal studies, and there are some longitudinal studies that indicate that there are individuals who the gender identity evolves and changes over time, and so they at times regret some of the decisions that they made earlier on, and our role, as you said, is to provide informed consent. Do we also hold liability?
That's an interesting question. So it's kind of like, if you have done your due diligence in providing informed consent, right? You have informed them of all the risks and benefits and have basically informed your client, like, once you do this, you can't walk it back. Like, I really, even with my adolescent clients, so one thing, a teenager isn't thinking about is, having biological children someday, right? But it's my ethical responsibility to talk to them about that. So I'm even talking to 14, 15, 16-year-olds about the fact that once you start hormone replacement therapy, you can't walk this back. There is a very large risk that this won't be on the table for you. So I always inform my clients that, including my teenagers and my adults, even if there is a microscopic chance that one day you might want this, right? You need to consider seeing a fertility specialist before you make this decision, right? If this is a financial possibility, and financially, sometimes clients don't have that option, right? It does cost a lot. And I try to give them resources for charities and organizations that'll help them pay for that, right? That's also my ethical responsibility. So I make sure every facet of conformed consent is done, and that's kind of where it covers our liability. And then also when they go see the doctor's job and the endocrinologist's job is to also continue to provide that informed consent. So they're getting that conformed consent all the way around. Every step of the process, they're getting that. But we also need to provide that as the therapist, right? And so that they really have a full understanding. And the percentage of clients that really regret their decisions is very, very small. It's a small percentage of a very small percentage.
Okay, thank you so much.
Yeah.
Yeah, because I do want to say that for most people, they don't come to counseling when they first start thinking about this. This is usually something that they have been in process for years, decades. At least in my experience. I don't know about yours, Laura, but mine for sure.
So
yeah, I have one client who had it was definitely something he thought about when he was younger. His first sexual attraction, it was something that came up, and then he repressed it. And then due to other life circumstances in the pandemic, it all came bubbling up over. So that was kind of that client's experience. So it wasn't as if it ever went away, it was there. So sometimes our clients use coping mechanisms to repress those feelings, of gender dysphoria, which is what that client did. But like Dr. Lilly said, it was there, right? It doesn't just go away. They've thought it, they may not constantly think about it for years, but it definitely was, it was there. Yeah. And so now it's like, now it's at the forefront, like it, like for that client, it's like, okay, now I have to do something about it. I can't move forward with my life. Like this client has put their whole life on hold, and like, until something happens, like they feel like they can't move forward.
Right. Laura, there's a question in the chat too.
Okay. Do you think people considering opening their relationship should seek couples MFT counseling, specifically both small people? I think yes, it would be helpful. And actually most of my clients that are do couples therapy as well. They both see both like my couples that have seen me, I am just one piece of 3 therapists. So they each individual has a couples therapist. They have a couples therapist, and then they each have an individual therapist. Yeah. And I have been approached to do both couples counseling and be individual therapists. And so that's something that ethically I tell my clients, even in consultation, you cannot have the same couples therapist and individual therapist. That's a conflict. And so I remind them that if a counselor is trying to tell you they're going to do both, that's probably not a good idea.
Probably not.
Yeah. Also recognize the benefit to. Yep. Okay. Did I answer that question, Paloma? The answer is yes, they should. Yes, it's a good idea.
So Laura, what should newer counselors, right, who are, you know, just getting into the field, what would you recommend they do to be able to serve this population? Is there anything in particular?
Yeah, I would attend anytime you have the opportunity to attend a training, whether it's at the ACA conference you attend, or take advantage of a lot of the free online trainings that are going on. Anytime you have an opportunity to volunteer at a community center or an event, I would do that. Start reading books and stuff specific to the population. But I think the best thing is to get involved with the community, put in some volunteer hours. Like I said, immersion's key.
Mm-hmm.
I mean, you don't have to do weekly like I did, but even if it's once a month or for big events, it's Pride Month.
And I think it's important how you do that volunteering, like, and with this particular group, I'm not too worried about this, but you know, that you go in with a servant mindset and not, I'm coming in to help you. More of how can I best, you know, support you, and what do you need me to do?
Yeah, I would do whatever it was, from making coffee to answering the phones to, and I did a lot, like anytime other big program needed supporting. So like I did a lot with like Trans Initiative, which is one of our other programs at the center. Every Thanksgiving, they would do a Transgiving, and I live in I'm originally from Illinois, so I'm here in North Carolina. So a lot of times, if I didn't go home for Thanksgiving, I would serve on Thanksgiving. So I would go in. So basically Transgiving was a program for those who, you know, aren't supported by their families, trans individuals that don't have a family to go home to for Thanksgiving. They would come, and we would have, you know, 50, 75 to 100 people come and have a Thanksgiving meal. And so I would cook, I would bring food, I would come set up, I would tear down, I would clean. And so I would spend all Thanksgiving with the trans community. And so there's things like that you can do as well. And I'd also help with TDOR every year as well, before I started working with the youth, which I mean, I still help with which is Trans Day of Remembrance too.
Mm-hmm. And then if you could, because I think it would be of interest to several of the people that are on this and will be watching this, could you talk a little bit about Aspire?
Oh, yes. So Aspire is our youth leadership camp. We used to do that. It used to be in March, in which was a sleepaway camp for the weekend. And we taught leadership skills, how to make SMART goals in order to take those SMART goals and move them into action to make change in their community. So youth from all over the state of North Carolina, sometimes South Carolina, would come for the weekend and really learn leadership and organizational skills on how to make change in their own communities, everything from starting a Gay Straight Alliance, which if you've ever heard the term GSA, to maybe starting their own events or getting involved in their community in any way. And so then it was also we do workshops too, and have speakers come in. It was probably one of the only opportunities they got LGBTQ affirming sex education. One of our volunteers is a sex therapist, and she goes out into the community and does sex ed sometimes. And so they got, first time they ever got LGBTQ, because we're from the South, so a lot of our sex education is abstinency based, so they got to ask questions in a safe environment, and that was really helpful to them. But now, because of COVID, we're kind of revamping and doing Aspire, which actually I'm really excited about, because we're kind of aiming more on a social justice platform. So I think which will help kind of switch and navigate our camp to include more youth of color. And so we are having an amazing speaker. Hopefully we can lock them down, but they're going to speak on social justice and also sexual violence and things like that in relationships. And so how you prevention on sexual violence. So how they can prevent getting in relationships and stuff like that, and on a consent model and things like that. So I'm really excited about having them come talk. But we're doing a day camp this year, so it'll just be for the day until we can go back to doing a sleepaway camp. But really excited about that and working with the kids. So
I know that it was transformative for Ren. My older one went and was on the Youth Leadership Council, and it was they really kind of solidified who they were through those experiences. And I think also going to the conference was another big one. And a lot of these events that the center does, for the youth, it costs them little to nothing to go. They cover, like when Ren went to the conference in Texas, y'all paid for their airfare.
We paid for everything,
yeah, hotel, even Laura took them to get a flu shot while they were there, and that was really helpful because they got the flu. But it was, the center just makes it really accessible. For my family, obviously I can help. So whenever Ren did something, I would make another, I make donations on a regular basis to the center anyway, and so I would always just donate some money to the center, whatever those events were, to help. But we weren't, and nobody was asked, really to pay. It was something that was included and provided. So it really created equity of access, like you said, to that sex education. The class that all of these guys are in right now, that's part of the component, is how do you have effective sex ed? And so I am curious for a little bit, and I know you may not know too much about it, but could you speak to kind of what makes that particular sex education effective for the students, and how are they engaged in it?
Yeah, so I think the most thing is using gender neutral terms when talking about sex and engaging in sex is, and so I think one of the best ones is like a female condom. We don't use female condoms, so we call them a barrier. We've even moved away from dental dam, and so explaining to them how to use those things and when to use them. We don't refer to in gender terms when we talk about their penis or vagina or things like that. So we also make sure we say or we don't talk about sex in terms of female or male, right? So we talk about penetrative sex, things like that, oral, things like that. So we make sure we're using very gendered neutral terms so everybody feels inclusive. And we're really educating them on the spread of STDs and how to prevent it. We talk about PrEP and things like that. So we make sure they're educated about HIV, and we don't shy away from the topics. So we're very straightforward with them and letting them know, and that this is, and we talk really, really heavily about consent all the way through, and about their right to revoke consent. It's a heavy consent model. So we talk about consent from every aspect, and that they can take consent away at any point. And so we really, really push and harp on that pretty much in everything we do when it comes to sex. And we're very sex positive at the center, not just with that. And so we don't put any shame aspect into it at all. Okay, well, I was recognized that by political ads can be helpful. Is there tension around lumping together of gender identity and sexual orientation when the two are completely different things?
I would say there's overlap though.
Yeah. Wouldn't say once there's overlap, I wouldn't say we really. Do you mean like in the organization by putting LGBTQ together, like lumping them together like that, or do you mean like
yeah, especially like the in popular culture, like people try to do their best to. We all try to do our best to be respectful, and that like in terms of when talking about like gender and the community of gender identities, and but that is different to a significant degree from
sexuality,
from sexual orientation.
Yes. So this is kind of where some of those like within the community, some of those like microaggressions and bias come in. So as a community as a whole, like gender minorities and sexual minorities, like it's like a support, like that's why they're all lumped in together. So they're considered one whole of a community. But even within the community, like we still have populations of people that like refuse to use correct pronouns, or like really struggle using they and them. And so really like even within the LGBT community, sometimes like transgender and non-binary individuals are still marginalized within their own community. So like that still happens, like because they're lumped together, like there's still that like bias that sometimes happens. But it still does overlap, like the sexual orientation and gender identity too. And also like, I think one thing that's interesting that comes into play too is like having a transgender individual identify as straight is something that sometimes becomes problematic within the queer community. Not that it's not supposed to be, but sometimes that person kind of gets like ostracized, like, oh, you're not queer enough, like because you're transgender and you identify as straight, like, and so that sometimes becomes an issue, which is really unfortunate. It's like that's something I in my trainings try to explain to straight cis people that that's a thing that can happen, and then the queer community also rejects it. So it's like trying to like, I'm out here explaining it to straight cis people, you guys need to get it too. Sometimes it can be frustrating.
It's kind of like for bisexual people where, you know, gay, lesbian, or straight say,
yes,
pick a side, you know, it's like, why do you have to pick a side? Why can't you be anywhere along that spectrum?
But working with youth, the one thing I'm like very hopeful about is they're more accepting and open, and a lot of that doesn't tend to happen with the younger generation.
They have a much more a deeper understanding of what expansive means.
Yes.
Yeah. All right. Well, any other questions? We all know I love takeaways, so I want to hear your takeaways. So David, why don't you start us off? Do you have a takeaway from today?
There we go. Gotta get unmuted first. Yeah, I think this idea of the, I don't know if the word is the challenger struggle, just, you know, as I think about transgender individuals and having that truly safe space to just be and to process, and how valuable that must be. I think that's what struck me as Laura was talking. And, you know, to imagine individuals in this place who have had this struggle that I'm sure could be all consuming seemingly, but also, you know, is but one aspect of who they are. And,
right.
not only having a safe place to explore that, but having a safe place just to be who they are fully, and not have that be totally be what's sort of controlling their lives. I just hearing her speak, just the value of what that must mean to them was what struck me.
Yeah, I think earlier you said, just telling them they can be their authentic self, and what that might mean. Yeah. Thanks, David. Kaylee, what about you?
Yeah, I'll kind of echo that. I am not new to the LGBTQ community, but I am new to particularly trans issues. And so this was affirming that I do have a general idea of some of the common issues, but just a reminder to keep exposing myself, to keep listening, and just remember that it's so nuanced. But yeah, this has been helpful in that way.
Thanks, Kaylee. Lizzie.
First of all, I echo both David and Kaylee said, but I love concrete action items as takeaway. I think I'm super excited about the resource I just got, the standard of care. I think it's gonna be, I'm probably gonna read that this afternoon. This provides such a comprehensive knowledge for clinicians to work with, or any health providers to work with transgender clients. So yeah, thank you for that.
Mm-hmm. For sure. Thanks, Lizzie. Mark?
Predominantly because I joined late, the importance of our role in providing informed consent, and making sure that I think that over time, as certain parts of the population become more okay with different expressions of gender identity, we'll see parents and adolescents coming in for counseling at an earlier age with these issues. And so I think that the informed consent piece becomes even more important at those ages. So thank you.
All right. Laura, thank you so much for being with us today. I appreciate it. And I'm just going to put a plug. We have a couple of other ones. Laura knows one of the other individuals that's going to be coming, Elizabeth, and she has an amazing, knowledge about different populations, kink, BDSM, poly. Laura and I go to her sometimes.
Guru.
Yeah, exactly. So Elizabeth's coming up next week, and then on Friday, if you haven't seen it, the Association for Counseling of Sexuality and Sex Wellness, they are having a training on Friday around lunch on serving kinky clients, and I think it's going to be a great webinar. That's from 11 to 1 on Friday. I have that information posted in the announcements as well if you can make it. I think it's going to be a wonderful tool. If you're not a member of ACSSW, it's like $10. It's not an expensive training for 2 hours. And then we have the ACSSW president-elect. I'm so excited. Fran McLean is coming near the very end of our class, I think on the 24th or 25th. I can't remember which one right off. And she's going to just talk about what that organization is and what's involved in that. And if you're interested in, continuing and learning more or working in this area, she is going to provide some information on how to engage with that association. So super exciting. I really feel like amazing guest speakers. So Laura, thank you again. I really appreciate you. You know that. I tell you that every week. So
You're so welcome. And Elizabeth's actually the one that teaches our sex education. So at Aspire, so she can answer.
So we'll be able to pepper her with questions when she comes together. All right. Thank you all for being here. If there's anything I can do to support you, you know where I am. So don't hesitate to reach out. All right. Have a wonderful day.